Welcome to Transcultural Communications, Chapter 6, Healthcare Subcultures. Learning about culture requires learning about yourself. It is often easier and more interesting to learn about cultural beliefs and practices that are exotic or different from your own. However, to develop a true appreciation for the power of culture, it is necessary to learn about how our own culture affects our beliefs, our actions, and our expectations. This knowledge is imperative in the profession and in which there are many multiple layers and overlaps in the variety of cultural and subcultural groups. This chapter explores the concept of transcultural communications within the subculture of the Western healthcare system. It explores the overlapping subcultures within the healthcare system and identifies specific areas in which miscommunications can occur because of cultural differences. Western healthcare system is a belief system that has a reliance almost completely on the biomedical belief system. This often causes ethnocentrism about the value of biomedical interventions by healthcare workers. Hospital subculture. The hospital in Western culture is a complex organization dedicated to the common goal of healthcare delivery. Health is defined as the absence, minimization, or control of disease processes. The various players in a hospital will work toward this common goal. One of the major subcultures operating within the hospital is the professional subculture. This includes nurses, physicians, therapists, and pharmacists. They are licensed by legislative authority to provide health care. They've been educated to put their patients first without regard to the financial cost or the effective use of resources. Their oath is to do no harm. The commercial or business subculture is another strong subculture in the Western hospitals. As complex organizations, hospitals need expert business managers and administrators who can maintain an environment for meeting the goal of delivering healthcare. The values that members of the business subculture bring to the hospital environment include maintaining the health of the organization through support systems. These support systems include maintenance and supplies, financial responsibility, and marketing. There is often a clash between the professional subculture and the business subculture, especially in terms of cost-effective care. Monetary managers look at the cost-benefit analysis of a test or procedure. Healthcare often becomes a compromise as a result. Technology-based healthcare also forms a subculture. The more high-tech the specialty is, the more status it is given by society. For example, people who work in cardiac surgery have a higher status than someone who works in a rural care facility. Long-term care facilities also have a different subculture. Whereas a hospital wants to cure and release a patient, the long-term care facility expects progressive decline and death.